Are you sick of trying to work out with lower back pain? It's not hard to fix this. You just need to know the best exercises to fix lower back pain. Hey everybody, I'm Steve Daisy, orthopedic physical therapist and personal trainer with PT by PTs.com. Lower back pain stops a lot of people from working out. I was actually one of them once. It's kind of what got me into this profession. Oftentimes you just need a new starting point, kind of a safe space for exercises. You need exercises that'll help you, not hurt you. You need ones that'll give you a real workout, and not the puny little rehab exercises that physical therapists try to pawn off on you as a real workout. If you tend to get isolated lower back pain with weightlifting or activity that goes away when you stop, there are a group of exercises that are great for what I'm talking about. Now, this means you're not in the middle right now of a lower back pain episode where you're incapacitated, you're bedridden, you have pain radiating down your legs, you're not peeing your pants. In fact, if you are peeing your pants or you have numbness or tingling, like down there, get to the hospital. Turn off this video and go to the hospital. You're an emergency room patient. It's a sign of a pretty big central disc problem, probably. If you're not in the middle of a back pain episode right now, then you're perfect for what I'm about to show you. I'm going to show you 8 exercises that will help you get strong, help you get in shape, and in most cases will help you actually get bigger, and they'll all help your back at the same time. So let's get started.
The leg press is definitely the best choice for heavy training of the legs if you have lower back pain. While flipped over, it's actually kind of a bizarre looking squat. It's still an easy way to protect the lower back while lifting. If your legs are pretty strong, you can easily switch to one-leg leg presses as well. In fact, single leg press is a great way to lock the back in place and just work the leg with a reasonable amount of weight. The key here is keeping your hips all the way back, make all the bend come at the hip joint, and don't let your butt come off the seat. I love the lunge exercise for people with lower back pain because it exactly mimics proper body mechanics when lifting. It gives you an excellent opportunity to easily work on stabilizing your core while training your legs. If you're like most people who can do endless numbers of lunges, try holding each rep with your back knee just above the ground for 6 to 10 seconds and doing just one leg at a time. This will often get you to fatigue closer to the 8 to 12 rep range we're looking for. Besides keeping your back upright and moving through your hips, it's important to keep your knees behind your toes, which decreases stress at the knees. As soon as your front foot hits the ground, drop straight down while concentrating on keeping your core tight. You should feel all of this in your quads, hamstrings, and glutes, with nothing in your lower back or knees. Control of the hips through the gluteal muscles is critical to normal lower back function. Specifically, we're talking about the gluteus medius posterior muscle, which is just beneath the gluteus maximus muscle. A study from 2015 by Kendall and colleagues showed that subjects with lower back pain were on average 31% weaker in the gluteus medius muscle. After a 3-week strengthening program, they had a 48% decrease in lower back pain. The best way to work the gluteus medius posterior is by kicking the leg to the side and back. Machines can't mimic this very well, so we'll use the side-lying hip abduction exercise. While this may seem a little 1980s at first, if done properly, the side-lying hip abduction exercise is actually much harder than it looks. Here you can see how my hand is on my pelvis. My right hand is pushing my pelvis and core forward so that the weight of my leg doesn't roll my trunk backwards. I'm kicking back behind me and up toward the ceiling at the same time. If I rolled backward, my leg would end up in front of my torso. We don't want that. The path is up and back. You should feel all this in your gluteal muscles. Adding resistance is easy, as even a 5-pound weight on the end of your ankle is a lot. One of the most common ways people injure their spine is through rotational movements. Rotation rarely gets trained in the gym. Granted, rotational exercises using the hips while keeping your core solid and tight isn't going to make you huge, but it can give you great functional strength. What you want to do here is make your entire upper body one solid block. No movement through the spine except possibly at the very end of each movement. Draw in the lower abdomen, tighten the entire core, and twist through your hips. Really swivel through your hips. Your leg muscles are then doing the main work while your core is simply holding and protecting your spine. You should end up feeling most of the burning and fatigue in your oblique muscles. While the push-up is primarily thought of as a chest exercise, it's also one of the best core exercises around. It's basically a dynamic plank. And push-ups rarely, if ever, bother the spine. So why not use an exercise that builds up your chest and strengthens your core at the same time? The key to any push-up is of course keeping your back as straight as possible. Some of this should be accomplished by drawing in just your lower abdomen with about a 20 to 30% contraction and holding it for the first few reps. If you're already pretty strong in the pecs and can do more than 20 push-ups, there are numerous variations such as one-arm push-ups, step-over push-ups, and archer push-ups, any of which you can perform first in order to fatigue sooner. The two-hand shoulder extension takes you through the motion of a pullover very safely. While you do lose out on the overhead part of the lift, it's still very effective for both the lats and a little for the pecs. What's really nice is that with good posture and enough weight to fatigue in the 8 to 12 rep range, you'll have to use your abdominals and obliques significantly while in a standing position. This is an incredibly functional way of training the core to protect the lower back. There are just seemingly an endless number of abdominal exercises you can do for the core. Few are more utterly boring than the supine leg thrust. However, it's a great place to start. The supine leg thrust will quickly teach you how to correctly use your abdominals to protect your spine during any ab exercise. During the entire exercise, you'll need to keep your lower back flattened. Do this by performing a posterior pelvic tilt and holding it during the exercise. This will keep the lower abdominals in a contracted state. From this position, start with one foot on the floor and the other leg in the air. Slowly lower the leg in the air straight out. If you can do that at least 15 times without losing the flat back position, do the same motion with both legs in the air. Once you have that 15 times without any difficulty, switch to lowering both legs at the same time. And once you have this mastered, you'll be able to do most types of abdominal exercises. You should never feel fatigue in your lower back doing these exercises. All the fatigue should be felt in the abdominals and oblique muscles. The Roman chair or lumbar extension exercise is designed to train the erector spinae muscles of the lower back. Frankly, this exercise is not for everyone. I wrote about this extensively in my book, Hacking the Growth Code, available on the PTbyPTs.com website. Realistically, this is not how we use our lower back muscles. However, there's still plenty of evidence that lumbar extension exercises can be very helpful for some people. If you currently have lower back pain, you can do this exercise, but you should really have a physical therapist help you, preferably one with some training in the McKenzie method of mechanical diagnosis and treatment. If, on the other hand, you only get symptoms when you work out, you can try this exercise at the gym or at home with a couple of cautions. First, do not hyperextend and raise your trunk greater than the plane of your legs. Second, you should never feel pain. You should only feel fatigue and burning in your lower back. Third, always do this at the end of your workout, since these muscles are active with every other exercise. And fourth, don't add weight. This isn't an exercise you should be using to build muscle mass. Think of it more as an endurance type exercise, which is the way these muscles are actually used. You can also do this easily at home by simply placing some pillows into your stomach and raising up to midline.
So this is by no means a complete list. It's just a start, but these are definitely some of the best exercises to help fix your lower back pain and get strong in the process. Thanks so much for watching. If you want to learn more, please check out my website, PTbyPTs.com, personal training by physical therapists, where we also have our 12-week core spine strength program. If you enjoyed this video, please hit the like button, subscribe, comment, and visit the website. Until next time, I'm Steve Daisy with PTbyPTs.com.